All right, let's be real for a second. Have you ever just dreamt of a life without the daily hassle of glasses or contact lenses? Well, today we're taking a closer look at the technology that promises exactly that: LASIK. You know what I'm talking about, right? Waking up and actually seeing the world clearly. Going for a swim without that nagging worry about losing a contact. Or, never having your glasses fog up when you walk inside on a cold day. If any of that sounds good, then you are definitely in the right place. For literally millions of people, LASIK isn't just some abstract procedure. It's a real shot at a life without all that. It represents the promise of permanent vision correction and really a whole new kind of freedom.
So, in this explainer, we're going to break it all down. We'll get into how it works, who it's actually for, and, super important, we'll weigh the real benefits against the potential risks. We're going to separate the facts from the fiction so you can see the whole picture. Let's get started.
So, how in the world does this technology actually work? How can a laser permanently change the way you see? It sounds like science fiction, but let's dive into the science behind the sight. Okay, that is a mouthful. But at its core, LASIK is actually a pretty straightforward concept. Think of it like this. It uses a super precise, cool beam laser as a microscopic sculptor for your eye. By gently reshaping the cornea, that clear front part, it corrects how light focuses on your retina, and that's what clears up your vision. And it all happens in 3 really quick steps. First, the surgeon creates this incredibly thin, hinged flap on the surface of your cornea. Second, they gently lift that flap, and the laser, which is guided by a precise map of your eye, removes a microscopic amount of tissue from underneath. And finally, the flap is just laid right back down, where it naturally seals and starts to heal almost instantly. Now, I know what you're probably thinking. Does it hurt? That's one of the biggest questions, right? Well, the whole procedure for both eyes is incredibly fast. We're talking often under 15 minutes. They use anesthetic drops to completely numb your eye, so while you might feel a little bit of pressure, you don't actually feel any pain. Okay, so now we know how it works. But with any medical decision, it is absolutely crucial to look at the full picture. You have to see the incredible benefits right alongside the potential risks. The upside is, well, it's pretty compelling. The obvious one, of course, is freedom from glasses and contacts. But the recovery is also amazingly fast. A lot of patients are back to driving and their normal routines the very next day. And remember, the goal here isn't some temporary fix. It's a long-term, stable improvement to your vision. But of course, as life-changing as LASIK can be, it is still a surgical procedure. And that means there are potential downsides that you absolutely have to be aware of before you even consider it. The most common side effects are usually temporary and totally manageable. We're talking about things like dry eyes, which you can treat with drops, or seeing some halos around lights at night. For most people, these things just fade away in the weeks after the procedure. Now, serious complications are very, very rare, but they do exist, and that's exactly why that pre-op evaluation is so critical. And this really gets to the heart of the matter. LASIK is not a one-size-fits-all deal. A consultation with a qualified surgeon isn't just a suggestion, it is the only way to figure out if the benefits truly outweigh the risks for your specific eyes.
Okay, let's tackle some of the big myths floating around out there about LASIK, because there are a lot of them. It is time to separate fact from fiction.
First up, the big one, the myth that LASIK is painful. Let's just put that to rest. The fact is, your eye is completely numbed with anesthetic drops. Most people say they feel a moment of light pressure, but that's it, not pain. Next up, safety. Some people worry that it's this risky, newfangled thing. The reality? LASIK has been around for decades. It's actually one of the most studied elective procedures in the entire world, and it has an exceptionally high rate of success and patient satisfaction. So what do the outcomes actually look like? Well, the numbers really speak for themselves. The overwhelming majority of patients, around 95%, achieve the vision correction they were hoping for. And that other little slice, that usually just represents people who might need a follow-up enhancement to fine-tune the results, not a failed procedure.
And finally, there's this myth that it's for everyone, and this is just not true. There are really strict criteria in place to make sure people get the best possible outcomes, which of course brings us to the most important question of all.
So after all of that, the big question remains, could LASIK actually be right for you? Let's quickly run through the general checklist that doctors use to figure out who's a good candidate.
So, what makes a good candidate? Well, a few things have to line up. First, you need to be an adult, and your prescription has to be stable for at least a year. This just makes sure your eyes won't keep changing after the procedure.
Your overall eye health has to be good, with no major issues like glaucoma. And most importantly, your cornea has to be thick enough. The procedure removes a tiny bit of tissue, so starting with enough is really the key to safety.
So if there's one thing you take away from all this, let it be this. Candidacy is everything. Those high success rates we've been talking about, they are only possible because of careful patient selection. That detailed screening with a surgeon isn't just a suggestion. It's the non-negotiable foundation of a safe and successful outcome.
Ultimately, the goal of a procedure like LASIK is, of course, to give you clear physical vision. But it makes you think about a bigger question, doesn't it? Whether it's the tiny details of a painting, the expression on a loved one's face from across the room, or maybe just the path ahead of you, what would you want to see more clearly in your life? That's a powerful thought to end on. Thanks for joining me.